Hello, welcome to my YouTube channel. My name is Zeti at Nashville. I do videos to do with healthcare, lifestyle, and what's popping in the medical world. So we get informed here and there. All right. So today I want us to focus on the series I had started about the new signs of COVID, new symptoms that are being ignored and that are happening. Okay. So today I want us to talk about ear pain. Ear pain, yes. I know you might be wondering, ear pain again? Yes. It doesn't come isolated. It comes with other signs, especially people who start up with sore throat. And most of the people have sore throat, okay? So when you get a sore throat, it can either just stop at a sore throat. If you get the right medication or if your immunity is higher, it disappears, okay? Or it can be a descending infection that goes to your larynx and then it goes all the way to the bronchioles and then to the lung field, and then it becomes a complicated lung infection. Or it can as well ascend upwards, yeah? And when it ascends upwards, was the blockage of the eustachian tube, and that is where we come with our topic of the day, mid-ear infection, okay? So the eustachian tube that I've mentioned, its function basically is to equalize the atmospheric pressure with the inside the middle ear, between the middle ear and the outer ear. So the outer ear and the middle ear are separated by a tympanic membrane, which is usually called the eardrum, okay? So when you get the infection of COVID or any other viral infection or an allergic condition that causes your nostril to block, it tends to put pressure internally on the eustachian tube, and so it blocks it permanently. Normally the eustachian tube is blocked and only opens up when you're yawning, swallowing, or when you're chewing, yeah? And all these action, they help in equalizing the pressure that the pressure that we have talked about in the middle ear. When it blocks, there'll be no drainage of fluids inside the from the eustachian tube to the throat. So when that happens, there's accumulation of those mucus and other serous fluid that are being produced in the middle ear from coming out, because the throat is that is the eustachian tube, that is its function. So when they don't come out, then they accumulate in there, and with accumulation, it creates a very good field for growth of bacteria or the viruses, and then there is an infection around the middle ear. So it can cause now pus, yeah, when there is an infection, especially bacterial infection. So there is pus that is accumulating, and then there is pain because of the pressure of the accumulation of the fluid and also the infection itself. So this pressure can cause issues on your tympanic membrane, yeah? So when your tympanic membrane becomes infected or is under pressure, it tends to bulge out inside the outer ear. So when it bulges out, there's that pain, there's that ringing, and there's redness. When the doctor checks, he will see redness. So with a lot of pressure, the tympanic membrane can rupture and then release the fluid, the accumulated fluid and the pus and everything. That is what we call someone is having an ear discharge. So it starts coming out, yeah? And when it ruptures, when it comes out, when all of it is drained, then it starts healing slowly, or it can remain like that depending on the condition of the rupture. Warrant an ENT intervention, ear, nose and throat specialist intervention, okay? Alternatively, if you get the right medication to unblock your nose or to cure your adenoid issue, then the fluid will start draining. But you must have had those complaints of ear ringing, pain, all those things because of the fluid accumulation, all right? So, and that is why most of the time when you have a cold, a very bad cold, and you get in a flight, yeah, on ascending because of the change in atmospheric pressure, you'll find out that you will either tend to yawn more, but the pain will be unbearable. You'll feel like your ear is about to rupture. Of that pressure, that sudden accumulation of pressure inside, yeah, because now if you have a cold, that blockage and all that process we've talked about, this is just an advice, either when you're getting in the airborne please make sure that your nose is not congested, because if it's congested, you will not enjoy your flight. Yeah, so that one we can talk about it later on in another video, but just consider that. And sometimes it tends to cause the real rupture of the tympanic membrane, so we have to be very careful. Okay, so basically that's it from me, and in case you get this, just have yourself checked, decongest your your nostrils, and probably your symptoms will go away. If they don't go away, have yourself checked by the ENT, ear, nose and throat specialist, and he will give you advice going forward on what to do. All right, so let us keep safe and see you next time in my next video. Bye.